Okay, let's take a look. Let's take a look. How we doing? Nope. Not doing it. Oh, there we are. Okay. I think we're there. I think we're back. Holy cow. All right. Just going to double and triple check things, and then I think that'll do it. I think. Okay, I think that's good. I think we got that taken care of. We're just going to share this on ye old Twitter, and then we're going to get the show on the road, as they say. Okay. Let's go here. Let's go here. Let's go here. Let's share this. Let's copy the link. Go on Twitter. Okay. Okay. I think we are sufficiently posted. The link is there. All right. Excellent. I think it's that time. Well, good afternoon, good evening, whoever you are, wherever you are. I am Dr. Patrick Lockwood, and this is UnShrink Me. And for those of you who are brand new and or who are kind of second or third time listeners, this is a weekly podcast about mental health, clinical psychology, psychiatry, and all sorts of things that relate to people getting better and living better lives. And specifically, this podcast is especially critical of the profession because my goal is to protect the consumer, protect people seeking out therapy, psychiatry, etc. like that from my peers and myself. Because all of us are prone to doing things that are neglectful, unethical, or even illegal, sometimes unknowingly and sometimes knowingly. So the spirit of this podcast is, can we create a platform and a community where people talk about issues that relate to clinical psychology, psychiatry, and the like, such that everyone understands things better, has a clear understanding of what works, what doesn't work, what's ethical, what's unethical, and related topics. And this week's episode is going to be a bit of a humdinger because of an article that came out. So, be prepared to strap in for some pretty gnarly criticism of the profession today. And again, as always, this is a weekly podcast dedicated to protecting the consumers and to calling out my colleagues and to calling out myself from time to time, because we all need appropriate skepticism and criticism to do our jobs better, to help people better, and to hurt people less. I appreciate you all being here. Please like, share, and subscribe. If you find anything interesting, helpful, please comment. If you're watching and you'd like to, add to the discussion or add some criticism or ask a question, please feel free to join the YouTube chat and I will try to answer and respond. As always, my hair is a mess. Just got out of the gym, so sorry about that. And as always, we are not NOT sponsored by Celsius, but this stuff is great. All right. So we're going to start off with a couple of softballs and then move our way right into the topic du jour, which is internal family systems theory. But before we get to that, let's just take some softball fun kind of posts and talk about them. As always, I try to find interesting stuff from Twitter and sometimes Instagram and just share it and describe it and have a conversation about what may be useful and not so useful. Okay, first things first, a bit of a softball post. There's this online clinician named Dr. Roger McFillin, and he put out a post on October 12th. And I'm just going to retweet it real quick before I describe it and we talk about it. Okay, Dr. Roger McFillin. His handle on Twitter is at DRMCFILLIN, Dr. McFillin. He says, and I quote on October 12th, in most graduate schools of psychology, and Willow's back there if you can see her, on most grad schools of psychology, they do not teach critical thinking or analysis. They push you to cite a source for every idea. Unless someone in the elite academic class has already published it, it cannot be truth. They teach you how to cite a publication, not to question conclusions. They are not taught to critically analyze the methodology, seek out replicated studies, or to consider alternative ideas, but rather to accept authors' conclusions as the truth. This is a huge problem. Phil Bradley says, hoorah. And to you, Phil Bradley, and everyone else watching and listening, hoorah right back at you. Glad you're here. So again, Dr. McFillin's tweet from a couple of weeks ago says, in most grad psych schools and counseling schools, they don't teach critical thinking or analysis. Well, Dr. McFillin, boy, do I have news for you. There are actually a number of us that actually teach critical thinking. In fact, I teach a class for my university called Research Synthesis and Analysis for my MFT students. And it's a privilege to teach this class because many of the MFT students that I teach are very scientifically illiterate. And I don't mean that in a mean or critical way. I mean that in a literal sense. They don't understand basic statistics. They don't understand what an effect size is. They don't understand what a p-value is and why these things matter, in what contexts they matter. And after they leave this class, pretty much universally, I've been teaching this class for years and years and years, and everyone loves it by the end of it because I help them see how the sausage is made. I help them understand statistics in a critical and user-friendly way that's not watering down things, but also not overly complicating things. And they really appreciate the class because now they can go out there and read peer-reviewed papers and be appropriately skeptical of how they use language, how they use statistics, how they lie with statistics, things like that. I likewise do the same thing across different classes for my PsyD students. So Dr. McFillin, let me tell you, dear consumers of therapy services, many of your therapists don't know the first thing about statistics. Many of your therapists don't know the first thing about science. They don't understand philosophy of science principles. They don't really understand construct validity and why that matters. And so Dr. McFillin is correct that many people in psychology are scientifically illiterate and innumerate. They don't understand numbers. They can't have a good relationship with numbers. And so Dr. McFillin is correct that many people in the profession just are not scientifically, statistically, or numerically literate. They don't understand these concepts, how they make sense and how they don't make sense. He is correct. And there are many of us, including many of my colleagues at my university, who are doing a kick-ass job at teaching students how to be critical thinkers, how to use principles from philosophy of science to make clinical decisions, how to do differential diagnosis correctly, and how to understand what the implications of research actually are and what they are not. I've sat on a number of dissertation proposal committees and defense committees in my career so far, and sitting on these panels with other faculty, when we question students about their analytical plan and covariates and moderators and mediators and stuff like that, the students that I get to interact with have really good answers for how they're going to handle those things and what the limitations are. So I want everyone out there to understand that there's a problem in graduate psychology, more broadly, counseling, MD, PhD, PsyD, that yes, many people are statistically illiterate and they don't understand science. They just want to be therapists. They just want to talk to people. They just want to listen. They just love a good story, whatever. And that's true. And I have problems with that. But there are also many of us at universities all over the country and some professional schools who are trying to do the right thing, who are teaching philosophy of science, who are teaching statistical literacy. We do exist, Dr. McFillin. So don't give up hope. There are lots of people trying. I have great colleagues that I trust implicitly here who are doing a kick butt job. They're good people. They care about ethics. They care about philosophy of science. And they care about creating scientifically minded practitioners. That's our mission. We take that very seriously. So don't worry. It will get better. There are plenty of us trying who are doing a good job. So just for what it's worth, it will get better. There are those of us that care. We're out there. All right. Next post. Next up. I'm going to talk about what works in therapy. So there was a recent paper published, a meta-analysis, that talked about what works in therapy. And so the person I'm reposting is a guy named Nadim Hassan. He's a PsyD. Let me repost it real quick. So if you're ever curious about why therapy helps and if it helps and how it helps, this paper that was published, I think in like January in The Lancet, looked at the results of 177 studies, about 3,000 patients, basically, roughly, estimating. And so Nadim did this thread analyzing the basic points. So I'm just going to summarize the basic points that he pointed out from the paper, and I'm going to talk about each of them in turn. So the title of the paper, the meta-analysis, is Client Identified Outcomes of Individual Psychotherapy, a Qualitative Meta-Analysis. Now, just so everyone knows, there are lots of garbage meta-analyses, and this might be one of them. I haven't actually looked at the stats myself, so I'm just going to speak in summary, not with a lot of confidence, because I haven't actually looked at the outcome statistics myself. But here are the themes that showed up on the qualitative side of things. So theme number 1 was self-awareness and cognitive shifts. One of the reasons why people felt helped by psychotherapy is if they had an increase in self-awareness and a shift away from a prior mindset. Number 2, a self-attitude and personal growth. So they felt more acceptance of themselves, or they felt greater self-agency. Number 3, relationships and social functioning. People felt helped by therapy if they had an easier time managing relationships, functioning in relationships, and an easier time communicating in relationships, which improve the strength of those relationships. Number 4, increased coping and self-care. Like they felt that therapy was helpful if they could cope better and if they took better care of themselves. Number 5, emotional functioning. They had healthier relationships with emotions, which meant that they could tolerate them, understand them, manage them, and balance them better. Number 6, behavioral functioning. They reduced behaviors they found distressing or problematic, and they increased behaviors that they found helpful. Number 7, symptom relief and problem relief. Number 8, they felt generally more well-being, happier, things like that. Number 9, they had like a more existentially grounded perspective. They were more mindful in day-to-day life. And number 10, they had adaptive changes in work or family or whatever situations. So when I first saw this, I said, you can kind of summarize this as 3 different things, right? So there's 10 different findings that he summarized, but I can even synthesize it down to 3 different findings. So therapy works, whatever the type of therapy, CBT, DBT, ACT, motivational interviewing, psychodynamic psychotherapy, if you're doing 3 things consistently. Number 1, you're improving relational functioning. Because we need relationships to be mentally healthy, whatever that actually means. I don't even know what that means, honestly. But in order for us to feel better and be more adaptive in the world, we need to have better relationships. Number 2, we communicate better. Learning how to communicate. It's great. And number 3, learning greater self-agency. Those 3 things. Because coping is part of self-agency. Because learning how to understand yourself is part of self-agency and communicating better. All these things are great, but I'll tell you that most of them can be like summarized and simplified into learning how to have a better relationship with yourself and other people, learning how to speak up more for yourself in situations, high risk, low risk, and learning how to navigate relationships better. It's that simple. It really is that simple. And good therapy can do that no matter what the modality. It really is, because your self-awareness can increase in ACT and DBT. Your self-awareness can increase in psychodynamic therapy. Your self-awareness can increase in short-term therapy and long-term therapy. Your self-agency. So self-awareness, self-agency, I feel empowered, I can do things, and communicating better and coping better. It's not super hard. And you can do that in almost any type of therapy. Even with terrible therapists, you can learn these skills. In fact, as much as I am critical of the people who are unaware of their stuff, it's absolutely the case, by the way, just so you know, that sometimes when you have a bad therapist, they will teach you something about yourself. In a bad therapy situation where your therapist is inconsiderate or full of themselves or stupid or ignorant or whatever it is, you'll learn something about yourself. You will learn, for instance, that you have this need that is not getting met with this therapist who's incompetent. And so now you know where to get that need met with other people. You might understand the scope of that problem better. And I'm not saying it's okay that that therapist is incompetent. I'm saying, like, on the bright side, if you want to reframe it, it's like, what I learned is I have a need that I can't get met with these kinds of people, right? So good therapy can be summarized in these 10 ways according to this paper, but really it's increasing self-agency, communicating better, and managing relationships with yourself and other people better. That's it. Good therapy can do those three things, and good therapy can be short-term, long-term, and it can help people, whatever the modality, in all honesty. So I hope you understand that there's so many ways to be helped in therapy, and there is not a one-size-fits-all approach to therapy. Therapy is not this easy-to-define thing, unfortunately. And if you read people like Jonathan Shedler and his Substack, it's the case that there are different types of therapy for different types of problems. So I hope that makes sense to everyone. And I'm glad that we're seeing more and more peer-reviewed papers talking about what actually works and what are the outcomes that patients want. Because what you want as the consumer is actually what matters, believe it or not. It's not actually what the therapist thinks is helpful. It's actually what we believe the consumer believes they need or want. So I hope that makes sense to everyone. So good therapy, just in summary, there's 10 themes from that particular research paper I just retweeted, but there's 3 basic things that everyone should be getting from good therapy. Excuse me. It should be, number 1, increased self-awareness. Number 2, increased capacity to, communicate your needs, self-awareness, self-agency, communicate your needs. But number 3, most importantly, increased efficiency of managing relationships with yourself and other people. So managing relationships with yourself, managing your relationship with yourself process includes coping skills and insight and wisdom and all these things. Managing your relationships with other people includes assertiveness skills and boundaries and all those things. All of it matters. You can't just look at one variable independently from the other. So I hope that makes sense. I hope it's helpful. I hope you can kind of find those 3 things in any therapist, counselor, case manager, psychiatrist that you're working with. Okay? All right. Now it's time for the big kahuna. It's time for the topic du jour. So I'm going to talk about something that's really complicated, and I'm going to try and make it super simple, even though it's very complicated. Because there's a lot of politics, there's a lot of feelings, there's a lot of BS, and I'm going to try and sift my way through it on behalf of everyone watching and listening. Because I hate fads, and fads are bad for people. Fads are bad for people. I'm going to say this as simply as humanly possible. Okay. So while I'm finding the specific post that I want to talk about, I want to make sure everyone knows that the spirit with which I'm saying this is only critical of the profession specifically and not an individual person, if that makes sense. Because I'm not trying genuinely to indict a particular person. Okay? So I'm going to repost this right now. So I hope you go check it out on my Twitter feed. My handle on Twitter, in case you don't know, is at Alobha Patrick, Alobha, Patrick, which means non-attached Patrick. So, about 2 days ago, New York Magazine, which I am not a reader of, so this was just something I found on Twitter that everybody and their brother was talking about, and Therapy Twitter. Therapy Twitter is part of Therapyland, the world's worst theme park. So, Therapy Twitter was just having a field day with this paper, or this article that came out from New York Magazine 2 days ago. And here's what the post that New York Magazine titled or said. Here's what they said 2 days ago. Internal family systems is a treatment offered by tens of thousands of therapists, endorsed by Gwyneth Paltrow and Elizabeth Gilbert, and widely embraced on social media. Some patients say it's destroyed their lives. So I genuinely encourage you to go read the entire article from top to bottom and give it a fresh look and believe and say and think whatever you want after you read it. I'm going to give my opinion, and my opinion is just me, Patrick, one person, one, I guess, professional, and it's just me, and it represents no one else's opinion. I'm affiliated with a university. I'm affiliated with a number of treatment centers and people online and all this stuff, but this is just my opinion. My opinion has no bearing on anyone else in my life, any other relationship, any other professional organization. So, IFS, Internal Family Systems, is the treatment that New York Magazine is covering at this treatment center called, I guess, Castlewood in Missouri, where I'm from, interestingly enough. So I don't know Castlewood, so I have no opinion about Castlewood. I don't know them. I don't know this patient that they're talking about, but I'm going to try to summarize what this article talked about. So this article, this journalist found this patient and their father who was badly harmed by what's called internal family systems theory, because the therapist at this eating disorder treatment center called Castlewood in Missouri, where I'm from, the therapist basically did what's called parts work. And the treatment center has this therapist on staff who is basically, I think, and again, this is my summary, so if I'm getting it wrong or if I'm not perfectly accurate, don't come after anyone else. Don't come after Castlewood. This is me and my words. Come after me if you want. I don't care. But basically, I'm just looking at the article as we're talking. It appears that the therapist who is trained in internal family systems theory or therapy or whatever was talking a lot about childhood sexual abuse with this particular patient and some of the other patients that were there at Castlewood. And so the context of this is eating disorders treatment is very messy. If you don't know this, there are many treatment centers, intensive outpatient clinics, programs, residential programs that try to help typically girls or young adults or adolescents with eating disorders. And it's very difficult to treat. Eating disorders are extremely difficult to treat. And there's a lot of bullshit. There's a lot of mythology. There's a lot of bad research. There's a lot of bad dieting curriculum in eating disorders treatment. It's like a giant mess from top to bottom. And eating disorder treatment programs are just as bad as Rehabistan in many ways, in terms of like cultishness and pseudoscience and religion and all this like pathology and cult of personality. It's disgusting, and it's just as bad as Rehabistan. So generally speaking, the system is very flawed, and it's hard to find good programs. So I don't think Castlewood or whatever is uniquely the problem. I think there's an endemic problem. But the crux of this particular article from New York Magazine 2 days ago, is about this one program, Castlewood, and this one therapist who apparently was using internal family systems concepts, parts work concepts, which I'll explain in just a little bit, as a justification to excessively explore fantasies or beliefs or memories or recovered memories, which aren't real, by the way, of supposed childhood sexual abuse. And so apparently there's a patient that went to this eating disorders program called Castlewood who was basically manipulated by the therapist into believing that they were molested by their dad, and the dad did no such thing. So the lawsuit against this therapist in this program is like, you're convincing my kid that I abused them when I did no such thing. And just so everyone knows, this is not the first time in history this problem has shown up. Back in the early 90s, late 80s, there's this recovered memory bullshit that happened on the coattails of the satanic panic nonsense in this country, in the United States, where a bunch of therapists who believed in recovered memory thought a bunch of kids were molested or sexually touched or whatever it was when no such thing happened. And so obviously, as a clinician, let me say very clearly, it's really tricky. Sometimes people do have traumatic experiences that they don't remember super clearly. But the research on trauma, especially childhood sexual trauma, is fairly one-directional, which is the vast majority of people who've experienced sexual molestation remember it. They may not remember it super clearly with perfect detail like a movie or something, but they remember that it happened. They generally remember when it happened. However, the people who believe in recovered memory, like Bessel van der Kolk and all these people, believe that you can somehow like poke and prod patients who are in denial or repressing their experiences of sexual trauma, which is not true. It's just not factually the case. It's genuinely not the case. It's the case that sometimes we have a hard time remembering all the details, but it is not the case that people that have experienced tragic things or traumatic things would forget them, right? And so let me give you a prototype of an example. And this is just me making up something completely on the spot. I'm not talking about a particular patient I've worked with or whatever. So it sometimes happens that you had a relationship when you were a kid where people mistreated you and you didn't fully understand it or see it as a kid, right? So maybe you were 10, just making up an age. And maybe you had an older sibling or a parent that was rude to you and made fun of you and all that stuff. And it was kind of demeaning, right? And the kind of demeaning piece that I'm listing here is because it's kind of subjective, depending upon the culture, depending upon your relationship with humor, depending upon your relationship with yourself. If you're trash talking people, like in bro culture, that may or may not be funny, and it may or may not be mean or humiliating or shame inducing. So if you have that kind of demeaning relationship, that may or may not be traumatic. It may or may not be humiliating, depending upon how you're built and your culture and all these things. But when it comes to physical, touching, sexual abuse, molestation, and trauma, everybody knows if you're being touched or not. That's one of those are you pregnant or not things. So if you were touched, if you were literally molested, if someone attempted to touch your genitals, that is a are you pregnant or not thing. That's not a question. And so these recovered memory charlatans, these assholes, these idiots who believe that they can somehow cajole you into remembering that you're molested, literally are trying to take innocuous things and make them not innocuous. So I'll give you a crystal clear example. If you're a 5-year-old kid and your parent picked you up, right, like one hand on your back, one hand on your butt, to like pick you up and move you or something, you're not being molested, right? However, these recovered memory charlatans can talk to you as an adult and be like, remember that one time your dad picked you up? Like, did your dad pick you up and try to fondle you while they were moving you? It's such fucking bullshit. Like, yes, family members do that kind of thing, but it's not ambiguous. It's almost never ambiguous. It's almost always 100% clear that there's a pattern of behavior that this person did. It wouldn't have happened one time. It would have happened over and over and over again. Sexual molestation is a pattern of behavior. It's almost never a one-time thing. And so these charlatans will try to find victimization. They'll try to find experiences where you were molested or touched or violently assaulted because they believe that your behavior can only be explained by, as an adult, some childhood thing that happened to you. which is bullshit. Because a lot of people as adults are out of their minds for various types of reasons. A lot of people with severe depression, severe trauma, psychosis are that way because of recent events and drugs and all these things, but also historical events that are crystal clear, not needing to be unearthed by some magic skills. So what happened, I hope that's all clear to everyone. In summary, it's like there are charlatans who have doctorate degrees and MDs and all this crap who would like to do a bunch of archaeology on your brain and like basically conjure up crap out of nowhere, conjure up memories. And they're literally, we know this from all the memory research, Elizabeth Loftus and all these famous memory researchers, that therapists, authority figures, police officers can literally create memories inside of you by cajoling you and giving you prompts and all these things. And it's wildly unethical, and that's why it's not admissible in testimony in court. So it's really important that everyone understands that there's a difference between a therapist trying to help you understand what you crystal clear remember versus trying to help you remember something that you can't fully remember, if that makes sense. Those are not the same process. Because in the latter example, the therapist is trying to lead you towards something. And that's bullshit. If your therapist is like a lawyer asking you leading questions to help create a memory, that's bullshit. That's unethical, and you should leave that therapist. Jonathan just commented, so I want to pause and respond to his comment. Jonathan says, I was trained in IFS, internal family systems, 15 years ago before it became a big deal. It was a niche model in family therapy then, but I found it very useful for trauma recovery and untangling gridlock. Recovering memory, he's got some ... which means he's going to have a part 2, so I'll come back to his comment. But thank you for showing up, and I can't wait to see what you have to say. So just to continue my setting the table before I even talk about the actual article. So again, setting the table, there's this paper, or there's this article that came out in New York Magazine 2 days ago that talks about Castlewood Treatment Center in St. Louis, or near where I was born, where it's an eating disorders program, and there's this therapist that is using IFS, internal family systems therapy, I guess to cajole patients and are talking about recovered memories of sexual abuse, which is unethical and stupid, and that guy should be sued, basically, from what I can tell from the article at least. So there's a difference between talking about memories that you can clearly understand and recall versus some charlatan trying to help you craft or make sense of some ambiguous thing. That's bullshit. That's cajoling, and that's manipulative, and that's disgusting. And I think that's what happened at this Castlewood thing. And this father was accused of molesting his kid when he did no such thing. And it's absurd. There's no proof of it. So Jonathan's part 2 is here. So Jonathan says, recovering memories was not anywhere in the theoretical constructs and goals. Not even interested in that. The purpose was to increase differentiation. Right. So that's what I wanted to talk about. And thank you for commenting, Jonathan, because like IFS, I want to make sure consumers who read this article can understand the problem for what it actually is. So I hope it's clear the context of this particular article. And I hope it's clear that many treatment centers, whether the presenting problem is eating disorders or drug addiction or whatever it is, many treatment centers have therapists on staff who are very sick. There are many treatment centers, I'm going to say this super clearly so everyone can understand it. There are many treatment centers who have clinicians on staff who are very sick. And they can't see it because they want to be a guru, or they think they're smart, or they think they're special, or they just are in denial about how sick they are. And there's many of them, and they're out there, and we have to be careful. And it's sad that these people get hurt. It's sad that this dad had to sue this place to clear his reputation. It's sad that this younger adolescent or a young adult patient went through all this and was traumatized by this therapist, basically. It's very sad. It hurt, neglected, harmed by this therapist. Whatever happened, I don't know the specifics, but it's very sad this happened. But it happens, and it happens more than you all know. So be very choosy. Ask around. I can help you find programs if you want. It's hard. It's hard to find good programs. It's not super clear. It's it's not super clear when the program is going to hurt you, help you, or not. It's not 100% clear. There are lots of good people who help people. There are some well-meaning people who hurt people. And then there are some bad people in the program, in programs. So let me say this very clearly. I don't know anything about Castlewood. I don't know anything about this therapist who's a hack and a charlatan. I don't know anything about these people other than what I'm reading in this article. And so maybe the article is being fair, maybe it's not. But if this therapist was trying to do recovered memory bullshit with IFS as the fad justification for what they're doing, that's bullshit. So internal family systems therapy was created by this clinician who's kind of a rebel or whatever. And I don't have a specifically strong opinion about IFS personally, because IFS is just yet another recycled framework. It really is. And it's like there's so many gurus out there, and there's so many people who are trying to repackage things and all this stuff. And I think there's a great podcast he did with Andrew Huberman that I'm going to repost right now. So Schwartz was on Huberman's podcast like 7 months ago. But so the creator of IFS is a guy named Richard Schwartz, who's kind of a rebel, who says, all these other modalities don't help, or they don't help enough, and I need to create it this way. He admitted in the Huberman podcast that he's basically repackaging a bunch of psychodynamic stuff that was already in existence, going back to like Jean Charcot and all these people. So like the Freudian era people. So IFS, internal family systems theory, and like parts work or whatever, is just another metaphor for looking at the ways in which early childhood stuff can help you have splits in your identity concept, or the ways in which you're defensive against different wishes and beliefs and values and goals. So the idea that you have different parts inside of yourself is absolute bullshit, just to be clear. It is not the case that you have some, to use a psychoanalytic term, it's not the case that you have a split off part that you can't see. There are some people who are somewhat uninsightful who can't see this set of values over here, or can't pay full attention to these needs over there. That's true. But this idea that there's like a great wall of China between you, your self-concept, and another self-concept over there, your firefighter self and your loving self, or whatever bullshit, it's bullshit. It's literal bullshit. It's a scam. It's a way to make it so that people are not shamed for not being fully aware of things inside of themselves, which I have a lot of compassion for and I believe is useful. But the idea that you have specific parts inside of yourself is stupid. It's a metaphor. It's a metaphor that works for some people and not for others. And so if it works for you, God bless. All we want to do is make sure people are as integrated as possible and differentiated as possible, as Jonathan Cogburn was talking about in his response here. But the idea that you have some split off part that you can't see is absolute bullshit. What's true is that there are parts of yourself, again, speaking super broadly, and I hate even talking this way because it's so not specific, but the idea that you have motivations that you don't want to pay close attention to because they're not very pro-social. So just to give an example, right? It's 100% normal for every human being to not want to pay attention to the motivations that make them look bad. So for instance, every human being has an exhibitionistic self. Every human being has this desire to be seen and validated by the outside world. Now, some of us are built with a much larger or stronger tendency towards exhibitionism. We want to be professors. We want to be musicians. We want to be artists. We want to get attention and praise from the outside world more than the average person. That's a different kind of person than the kind of person who doesn't want a lot of praise and validation. But there's no one on the planet who needs zero praise and validation. We all need some, even 1%. And so some people are really ashamed of their exhibitionistic needs to be all self-psychology about it. Like some people feel ashamed of their desire to get attention because they were shamed as a kid trying to get attention, or they were neglected in their early attachment experiences. And so they learn to hide their exhibitionistic needs, whatever. And so that is not the same thing as saying you have a performer part, to use IFS lingo. That's bullshit. It's like not everyone needs to be a rock star in order to be healthy. That's such fucking bullshit. Like some people have a greater exhibitionistic urge or narcissistic urge than others. And they're just built that way thanks to genetics and early childhood stuff and all this stuff. And it's unique for every person. And so there is no protective part or whatever. That's just a bullshit metaphor that the IFS people sell you to get you hooked on a framework that's easy to digest. And that's what every modality does, by the way. Every modality, whether it's ACT or DBT or CBT, has easy to digest concepts that they're selling people so they can get people to pay for trainings and get them trained up on skills. But really, none of it is new, none of it is unique, and none of it is special or earth-shattering. And none of the peer-reviewed research tells you that it's actually earth-shattering in its outcomes clinically. None of these treatments has earth-shattering outcomes. So I hope you all understand that IFS is not the reason this charlatan therapist hurt this patient and this dad at this treatment center at Castlewood. So in defense of Dick Schwartz, which I never thought I would have said in my life, by the way, because I don't know Dick. I like Dick, but I don't know Dick, But I don't know Dick. I don't know Richard Schwartz. So I have no relationship with him. I have no financial ties to him. I'm not trained in IFS. I don't give a shit about IFS. I don't care one way or the other. I just think it's a bullshit metaphor that a lot of people like and some people don't like, but it's a metaphor and every modality has their metaphors, whatever. It's not special. It's not uniquely effective. It's not uniquely ineffective. It's just yet another treatment. So I hope you all understand that IFS is not the reason that this kid or this young adult and this dad got hurt at Castlewood. This author in New York Magazine is blaming the cult of IFS. And it's true. It's 100% true that some people are very culty about their modality, right? So one of the most disgusting things in psychotherapy land is the world's worst theme park. I have a t-shirt on my website. You can buy one. Therapy land is the world's worst theme park. It's literally disgusting. There's no one healthy who works in psychotherapy. So therapy land is the world's worst theme park. It is literally a place for people who don't know how to take care of their basic needs and get them met and do it in their professional life appropriately. So in therapy land, people have their loyalties to ideas and modalities, and that's totally fine. And that's normal because people have identities that they're trying to satisfy. And so in therapy land, the world's worst theme park, these people who like IFS or ACT or CBT or DBT have all these well-defended rationalizations and justifications, defenses, for why their belief system is better or whatever. And they're trying to justify their existence and justify why their modality works. Fair enough. That's what you do in any profession. Here's the thing. It is not the modality specifically that is uniquely harmful. It's the person. It's the practitioner. So at Castlewood, in this example in New York Magazine, in this article about IFS, it's not IFS that's the problem. It's not ACT that's the problem. It's not DBT, right? It's not the specific modality. It's the person. It's the practitioner. This practitioner is a charlatan who believes that he can find recovered sexual abuse memories and all this bullshit. And it's just not true. What's true is egotistical narcissists who believe, and this is my opinion, so sue me, don't sue anyone else I'm affiliated with, egotistical narcissists believe that they have some special understanding of patients. I'm going to say this again. If your therapist believes that they have some special understanding of you, they are the problem. It is not their modality that's the problem. The modality is just an acronym. It's just a set of tools. It's a set of beliefs or metaphors. It's not that special. Okay? And I'm not saying this in a narcissistic way to derogate and demean and diminish these things. They're all great and useful in certain situations. But when we put all this energy into blaming the modality, you're not blaming the appropriate problem. The appropriate problem is the person who's sick and can't see it and needs supervision, consultation, needs to be kicked out of the profession. So that's my rant. It's not IFS that's the problem. It's the person. It's the sick person who believes they have special, profound, magical powers to see and help you and rescue you from the terrible people who've hurt you. That's the person. That's the problem. That's the belief system. That's the problem. Jonathan says, I always explain parts language as a metaphorical way to visualize an emotional state you want to change. Fair enough. That's perfectly defensible. You're simply employing extra different cognitive capacity by using the word pictures. Yeah, metaphors are great. Nothing wrong with metaphors. Metaphors work. Your job as a good therapist is to find some way of communicating to the patient, relating with the patient that they can understand, that helps them feel, as I said earlier in the podcast, more self-agency, more ability to communicate and get your needs met, and more self-understanding, right? Jonathan says, no modality is magic. Every theory provides an incomplete description of problems and solutions. I'm going to say that again because that's great. You nailed it, Jonathan. Thank you so much. I'm exhausted even thinking about this because it's so like, how absurd is the world we live in currently? So I'm going to say what Jonathan said. I'm going to repeat his words again because they're just correct. Okay? So for you out there who are consumers of therapy, or for those of you who are in grad school right now looking to be a counselor, a KDAC, a therapist, a psychiatrist, a psychologist, whatever your journey is, I want you to hear this loud and clear. No modality is magic. This is what Jonathan said. I agree with it wholeheartedly, so I'm just going to reiterate it. No modality is magic. Every theory of therapy, I'm adding a word here, provides an incomplete description of clinical problems and solutions. Because every theory looks at one piece of the problem and doesn't look at the whole problem. So all of the individual therapy modalities like ACT, CBT, DBT, psychodynamic therapy are all radically incomplete because all of them do not account for the system around you and don't do systemic work. So likewise, all the family systems theories like Mnuchin and Bowen and IFS and all this crap literally doesn't look at the individual level variables effectively and address them effectively. Just like psychiatry doesn't effectively address the system or the individual behavioral patterns very well. So all of these modalities suck at looking at the whole picture. They're not designed to look at the whole picture. They're designed to give lip service to all the other variables and all that stuff, but none of them deals with poverty. None of them deals with, shame effectively. All of them suck at dealing with shame effectively because all of them have their rationalizations that defend against it. All of them suck at dealing with gender effectively because gender is not inherently built into any of these things effectively. So there's no one modality that's magic. And there's no one practitioner, by the way. I'm going to add an addendum to what Jonathan said. No one practitioner is magic. Every practitioner sucks in their own way, and every practitioner has their strengths in their own way. And so, dear consumers of therapy and counseling and Christian counseling and all these things, I want you to hear this loud and clear, that It is not okay or ethical when your therapist tells you this is the modality that will solve the problem. Because that's not true. Because your clinical problems are more complicated than just your symptoms. Because your clinical problems relate to problems of living, not just problems of feeling and thinking and acting. So your problems of living are contextual. Your problems of living are circumstantial. Your problems of living are historical and existential. And so everything that you're trying to address in clinical psychotherapy relate to your SES, your culture, your age, your gender, your race, your sexuality, your religious beliefs and spirituality, and your diagnostic clinical problems. Major depressive disorder or PTSD or schizophrenia or narcissistic personality disorder or whatever it is. And so you are a whole person, and no psychotherapy type addresses the whole person. None of them address your weight problem. None of them address your eating behavior well. Like none of them do. And so the goal is to be a whole person who's contextual, whose life is contextual. And it's really hard to address the whole person in therapy because there's so much to talk about. Sometimes people are so suffering and miserable that you can't even dedicate enough time to the whole person. That's not weird. So please, therapy is not some magic bullet. Therapy is not some one-size-fits-all thing. And IFS, in this particular case, that's, this circulating all over Twitter right now, IFS is not the problem in this case, in my opinion. In my opinion, the problem is this charlatan who has some pathological need to find childhood sexual abuse in every patient. Or in this particular case, at least. So when your therapist has a neat and tidy explanation of your problem, that person's a charlatan. Because the truth is, your clinical problems are usually much more complicated than one particular thing. It's almost rarely one particular childhood thing that happened to you. It's not just your attachment stuff that happened before the age of 2. It's almost never just that. It's almost never your one trauma or your multiple traumas. It's almost never just your drug problem. It's almost never just your depression. Like, it's almost always multiple complicated layers. We are layered people. We have social layers. We have individual layers. We have medical layers. We have all these layers that make us complicated. And so good psychotherapy helps you address all the layers. But no one modality addresses all of the layers well. None of them. Not a one of them. And if you have an ethical clinician, they will tell you. Ethical clinicians should tell you. I'm going to say it's super clear for all consumers of therapy services. Ethical clinicians will tell you that their scope of practice is narrowly defined and limited to this particular problem. We are not good at treating things that we can't do. It's not ethical for us to treat things we can't treat. So if you have an expert that you're working with that's helping you with obsessive compulsive disorder, their job is literally only to help you with OCD. Their job is not to resolve your childhood trauma or get you to get off drugs or to solve your relationship problem. That's not their job. Their job is to do like ERP or ACT for your OCD. That's it. That's their job. They have a narrowly defined job. And so ethical clinicians will tell you, I have a limited scope. And in that limited scope, I can only do so much. When I supervise interns, I'm very clear with them that we live in this ecosystem where we do therapy in Rehabistan. And in this limited context of 90 days or whatever it is, we can only do so much. So it's not our job to make guarantees or talk to patients in such a way that we can achieve a lot of things in 90 days, because 90 days isn't a lot of time. It's more like acute stabilization than it is deep therapy or something. And understanding that and getting a hold of that is hard for them sometimes. And not because they're stupid or something. It's just like, we want to help. And we see all these things that we can help. But the problem is that's not our job right now, right? And so scope of practice is something that a good clinician that's ethical, an ethical clinician, will be crystal clear with you about. And so this New York Mag article is wrong. This author, I believe, is wrong. And if you want to talk to me about it, whoever, let me see who this author is. Um, uh, so, dear Rachel Corbett, whoever you are, if you want to talk about your article and what you got wrong, I'm totally down to talk about it because I believe that the spirit of what you're trying to do is correct. So, dear Rachel, I believe what you're trying to do is correct. I genuinely do believe what you're trying to do is correct. But you have it wrong. It's not the IFS that's the problem. It's literally this charlatan who has these mental illness or whatever problems, pathologies inside of himself that makes him want to find secret, special sexual abuse or whatever that the patient isn't aware of. That person is the problem. The person is the problem. The professional is the problem. Culty IFS is not, unfortunately, the problem. I have all sorts of issues with cults. If your therapist just absolutely loves their modality, that person's kind of sick. They're kind of sick. They can't see it, but they're kind of sick because you shouldn't be in love with your modalities. That's silly. Because that's about you and you're narcissistic. I want to be special and helpful and important and powerful. That's not about the patient getting better. And so the focus is all wrong. But if your therapist is ethical, they'll tell you, I believe these things can help, and these are the things that I do, and the ways that I can try to help. And there's caveats, there's humility, there's clarity, there's precision in language. There's not, I love this and it's great. There's no superlatives or whatever. So I hope that all makes sense to you. And to Richard Schwartz, I mean, you've become a guru, and I don't know if you intended that, but bro, you gotta clean up your bullshit about whatever is happening with this article. You need to go on a podcast and explain what you believe parts work or whatever is good for, in my opinion, because otherwise people are not going to be helped. I think you're going to hurt people, and that's not good. It's really not good. So, and I don't think Dr. Schwartz or Richard is the problem. I don't think IFS is the problem. I just think he has an ethical obligation to go explain what he believes IFS is good for now, so he can, save his skin and maybe, maybe, get some credibility back. So I hope that makes sense to everyone. I hope everyone understands the spirit with which I'm talking about this article, because it's making the rounds on Twitter and social media, and I think it's going to be a big deal. I think it's going to be in the news too. So, for everyone, I don't want you to be disenfranchised. If your kid needs eating disorders treatment or rehab or therapy or whatever, like, there are good therapists. Not all of them are charlatans who want to convince them that you are a terrible parent. Some of you are shitty parents, just to be clear. Some of you suck at communicating clearly, managing your emotions, and having healthy boundaries with your kids. And you need to get your shit together. And some of you are just regular people who are doing your best. And some of you are great parents and your kids are very mentally ill because society sucks and you didn't keep them from the shitty parts of society. So there's all sorts of parents out there. It's a spectrum. It's not a one-size-fits-all thing. And if you need treatment, you can find good professionals. You can find good treatment centers. They're out there. I've worked with them. I know what they look like and smell like. So if you want to communicate with me, you can email me at lockwoodcoaching.com. You can find me on Twitter at Alobha Patrick, Alobha Patrick. I'll help. I'll help find local referrals. But don't give up. Just because this article came out and this charlatan hurt this family and hurts these kids, it doesn't mean that all clinicians are bad. It doesn't mean that all modalities are bad. There are plenty of good therapists. So as much as I'm here being very critical, it's not all bad. There are plenty of good programs. There are plenty of good providers. They're just hard to find because they're quietly doing good work and you'll never hear about them. So you need to find a professional who's in the know to help you find them, hopefully. Jonathan says, I trust IFS as I learned it. And I agree that he became a guru at some point, unfortunately. I appreciate and agree with your angle on the topic. No competent therapist treating trauma would do that, for sure. No competent therapist would do what was described in this New York Magazine article. So I hope this all makes sense to everyone. I hope you get the spirit with which I'm saying this. I don't want you to ever feel like there is no help. There is help. There are good therapists. There are good reasons to go to therapy. Therapy can sometimes be quick. Sometimes it can be long. It doesn't matter. There are different modalities that can help different types of people from different backgrounds. And there's no reason you can't get help if you actually need it. And some of you don't need therapy. Some of you actually aren't that sick and you have all the resources you need at your disposal. You just need better encouragement from your family and friends, and seek it out. One thing I genuinely believe is true is all of us deserve relationships full of encouragement, love, and understanding. And accountability, where people have boundaries with us and hold us accountable to our values and hold us accountable to our goals. So accountability, love, and encouragement and understanding are ubiquitous needs. And you can find them in your family, and you can find them in your imperfect relationships. Your relationships do not have to be perfect for you to get what you need from them. So please do not ever give up hope. Please do not ever give up on getting what you need in yourself, in your relationships, in your family, and your friends. Jonathan says, recovered memory is the bad part of the story. No Men says, in undergrad, thinking of doing an LMFT, are they going to take that bro's license? I don't know. Maybe they might take his license. It sounds like he has good justification for losing his license. Again, not knowing more than what's written there, it sounds like it, but I don't know. Maybe. So I hope this was helpful. I hope it makes sense to all of you. Thank you for showing up and commenting. Jonathan, Noman, Phil, great to see you. Glad you're here. I really hope that something I said today made sense, was encouraging, helpful, appropriately critical, caused you to think differently about the profession or about how to do therapy or how to receive therapy. I hope that you share this with as many people as you can so that more people can see an appropriately critical, skeptical, caring version of a professional that is making sense of what happens out there. And I hope that something resonated with you today. And as always, please like, share, and subscribe. As always, find me on Twitter at AlobhaPatrick. And as always, please, 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 never give up and take good care of yourself. And finally, I like to end my podcasts with a joke. So here we go. I once had this patient who had a really serious case of obsessive compulsive disorder and was obsessed with Pringles, the chip. It comes in a long tubular can. And so I don't know why she was obsessed with Pringles. It made no sense to me. And so we were in the very first session doing the diagnostic evaluation and getting to know her and all these things. And seemingly, very smart, very thoughtful, very bright, very nice person. And she was telling me about all the anxiety and all the intense, almost like impulsive urges she gets when she starts to obsess about Pringles. And I got kind of near the middle of the session, and I was just kind of flabbergasted because never in my career have I worked with someone with obsessive compulsive disorder who had these like intrusive thoughts about like a potato chip. It was just new to me. I've just never had this. So I was confused and genuinely curious. And so I couldn't help but ask, like, what happened? What is it about Pringles in particular that you think has you obsessing in this way? Because I've never heard about this before. And she looked me dead in the eye and she said, well, once you pop, you just can't stop. All right. Have a good rest of your weekend. I hope to see you next week on the show. Love you all. Take good care of yourselves, and I'll see you soon. Goodbye.